Same way that addiction behavior can create community, it can also create isolation. It doesn't mean that the absence of one necessarily creates the other. But I would say if we look at addiction behavior as coping strategy, then I would almost always say that there's something underneath. I use this with my patients of saying trauma with a capital T versus trauma with a lowercase t. Does it have to be something so traumatic that you have a diagnosis of PTSD and this is how you're coping with it? Certainly not. It could be from being a latchkey kid to having a really bad breakup. I think that there could be things as well that impact us in ways that maybe we don't process immediately, and that whatever addiction behavior we fall into puts a stopper in that. There's a stereotype or a narrative that folks with addiction are locked in the age in which the addiction became worse or it's most prevalent. And I think part of that is not because they stop growing emotionally, but because there's something related to that time that has not been fully processed. The more that I learned about it, the more my specific take was it does not have to be some huge trauma, but more often than not, in my experience, there's always something around that time that is related to the use or was related to the use, and it might be something different now.